For great craft cocktails with meaningful conversation, whether you're out entertaining a group or out for a memorable nightcap, the Distance Social is your spot for starting or ending the perfect evening. Located at 314 North River Street in beautiful East Dundee, Illinois. Go the distance and find your social at the Distance Social. Clocking out? Drive home with the Drive Time Deal with Matt McNeil on WRMN 1410 AM every weekday from 3 to 6 p.m. I bring you the hottest deals in town, the most intriguing stories, and the tracks that take the edge off rush hour. Tune in on 1410 AM. Catch us on YouTube Live at WRMN Radio or stream through our app. I've got the wheel to steer your evening right. WRMN 1410 AM, your home of radio shopping and the soundtrack to your commute.
Rise and shine, Fox Valley listeners. It's time to kickstart your day with First Shift with Marky B on WRMN 1410 AM. From 6 to 9 a.m., join the chatter that gets you clued in with the latest buzz around town. Don't just sip on your coffee. Let Marky B brew your morning with the perfect mix of news, views, and moves. Dial us in or live stream at WRMN1410.com and make your mornings a whole lot brighter. WRMN 1410 AM. We're the voice of the Valley, and we're here to talk.
Looking to get your fingers on some delicious grub? Look no further than Sticky Fingers in Carpentersville. Family owned and operated, Sticky Fingers specializes in chicken, fish, and shrimp, which you can choose to have dusted with flavor or doused in the sauce of your choice. Sticky Fingers strives to provide flavorful food with fresh, locally sourced ingredients. Sticky Fingers personally invites you to stop by and try one of their scrumptious dishes today.
And welcome to the 9 o'clock hour, which is Medicare made ABCDeasy today on the second day of April, another month. More great information, and Danny's here to lead the way. Good morning, Danny.
Good morning, and good morning, Elgin. If you have any questions or if you want to contact us, I'm going to give you our contact number, and that's 630-320-6906. Now, that's our answering service, so just if you call in, just leave your name, your phone number, and a little bit about what your question is, and we will get back to you. And we always get back to you within the 24-hour period. Now, today at the radio station, it's 847-931-1410. And we also have a new website, too, and it's called D Gilly, so that's dog, golf, insurancecompany.com. And if you want to go on there, we also even have our own app available. So we are getting into that technology world a little
Sounds
bit
like
more
it, Danny.
than...
Yeah. Sounds like it.
Yeah, so I want to kind of go over what this month we have actually 4 workshops. And we're really excited because we took a couple months off after the first of the year because we were so busy getting our clients ready and moving from one Medicare supplement to another. Or we also had clients that were on Advantage plans and come to find out they were on the wrong Advantage plan. So January, February, March is the time of the year that we do that. Now, the supplements we do any time of the year, but we actually do focus on those in like March, April, and May is when we really start focusing on those. People that have the same Medicare supplement, maybe had it for a few years, same company, and they're discouraged because they get so many rate increases. Well, there are options. So just don't think that you're stuck on the one company that you have. It's a Medicare supplement, because there's a lot of different options out there for you. So I want to go over our first workshop. It's on April the 3rd, and all of our classes are in the evening at 6:30 p.m. It's at Glendale Heights at the Public Library at 25 East Fullerton Avenue. April the 4th is Schaumburg Community Recreation Center at 505 North Springsgrove Road. Again, that's at 6:30. April the 8th, We have a Glen Ellen workshop. It's at the public library at 400 Duane Street in Glen Ellen. And April 10th, we're actually right here in Elgin at the Center of Elgin Conference, 100 Simply Way. That is also a 6:30 start time. So all of our evening start times are always at 6:30 if we have a Saturday, which we occasionally do, that's in the morning. So basically, I'm going to kind of reiterate more about what this time of the year is good for. Okay, so our Medicare Advantage changing, if you had made a mistake, is now over. So if you're on a Medicare Advantage plan, you're going to have to stay there until the upcoming open enrollment, which is in October 15th through December 7th. We can make changes that would start in January 1. But right now, we really focus on the Medicare supplement because most people think that the Medicare supplement can only be changed in that open enrollment period. That open enrollment, October 15th through December 7th, it is only for the Advantage plans and the prescription drug plan. And I can tell you, with our clients who are on the Medicare supplement, we do encourage, you will get a letter every year telling you that there's a rate increase. And if you're on a Medicare supplement, do expect that. But when you get that letter, what you need to do is make sure you call us and say, hey, Danny or Julianne or Eric, I got this letter from my insurance company, supplement company, and we're having another rate increase. And it seems like every time I turn around, it's another rate increase. And depending on what company you're with, you're going to see more rate increases. That does not mean that you have to stay there. Basically, what that means is give us a call. Let us do some research for you. We may find a company that is less expensive in the same coverage that you have now. I want you to also remember that in Medicare world, okay, each plan that you are on, and in this area, you're either going to be on a plan G or a plan N, or if you enrolled into Medicare prior to 2020, you could be on plan F. And if you do find yourself in plan F, that's because you haven't made any changes, or you have not made any changes. You've noticed that the premiums in plan F have quadrupled. Here's the reason. They're no longer putting people into plan F. As of 2020, the plan F was not available for any newcomers that were coming on to Medicare. So consequently, if they're not adding any new clients, the younger, healthy clients, for say, well then, on the clients that have the plan F, they're going to see some huge rate increases, and we have really seen some huge ones. Some people are paying well over $350 a month for their supplement, and that's really unacceptable. I can tell you that if you are on a plan F, give us a call because I know we can help you. I know we can save you money, and that's our goal. And also keep in mind, in Medicare world, in the supplement area, remember, Medicare makes the supplement plans, not the insurance company. So when you say to me, well, you know, I don't want to move this plan because I like that insurance company and they paid really well, well, keep in mind that if you have a plan G, as in George, or a plan N, as in Nancy, Medicare makes those plans. So I want you just to assume, give you an analogy here. Let's look at a can of Coke. Okay, you can buy that can of Coke at Walmart, CVS, Walgreens, any grocery store that you want. They all carry the can of Coke, right? Well, they're not in the back room bottling that can of Coke. That can of Coke is delivered to all of those retail outlets through the Coca-Cola company. Now, I want you to assume that Medicare is that Coca-Cola company. So they supply all of the Medicare supplement plans to all the companies that sell the Medicare supplement plans. So when you say to me, or if you hear a broker or an agent say to you, oh, we have the best plan out there. Our plan is the best. Well, remember, it's a can of Coke, okay? A Plan G is the same plan no matter where you purchased it. So if you're on a Plan G and you like that plan, you go, well, my insurance company that I've had with this has done a really good job. They paid all my claims. Let me also explain something to you. Medicare tells that insurance company how much they have to pay for each one of those claims. So what you want to look at when you're looking at a Medicare supplement, you want to look at their experience level. How often have they had rate increases? Do they have a large market share? Because a large market share means that all those dollars that goes out for a Plan G in this area, so let's say Elgin area, well, the larger the company is that have the most Medicare recipients enrolled into it, means that premium that they're paying is going to be lower. So when we sit down and look at an individual, there's a couple key things that we look at. Obviously, if you're in open enrollment, which means you just turned your Medicare on for the first time when you turn 65, or you had your group coverage and you're now 80 years old and decide that, well, now I'm going to take out my Medicare. That's what we call open enrollment. You have 7 months, 3 months before, the month of, and 3 months after to make that decision. Now, when you're in initial enrollment, there are no health questions. You can go on any supplement or advantage plan out there, and there are no health questions asked. Everybody gets a free ride onto Medicare then. But let's look at the people that have been on Medicare and they don't have any special time frames or special use. You haven't moved out of the area or you haven't lost coverage of your current carrier. So that means then the choice that you have then is the company that we can enroll you into. Now, I've also had some clients that come in and say, oh, Danny, I know I can't move. I had a heart issue a couple years back, and I had an angioplasty done, and I know I can't move. I'm stuck where I'm at. Well, not necessarily. Every insurance company has their own guidelines as far as the health questions that you're going to ask me or ask them. Another one, let's say you're just a tad bit overweight. Well, some companies will charge you a premium if you're over a certain height and weight measurement. There are other companies out there that don't even ask anything about height and weight. It doesn't matter to them. It's not part of their premium decision. Another one would be, let's say you actually had some surgery and you were doing some therapy, and now that therapy is all done and you're not going to the doctor on a weekly basis or monthly basis to do follow-up work. Well, then that means the chances of you getting approval on another company is really pretty good. Or if your medications that you're on are limited, and you say, I'm only taking 2 or 3 medications, and they all seem to be generics, so the chances are the prescription is not going to be an issue. Because in Medicare world, they do ask all the medications that you're on, and some of the medications that are not at the drugstore, that are over the counter, maybe vitamins and stuff like that. So we enter all of that into that application when we apply. There are health questions that we go through and ask health questions for you. And then it goes into their company, into their underwriting. And then they let us know if they accept you. And if they accept you, usually that underwriting process can be as short as 30 minutes. Or if they have to do a phone interview with you, then they may call you because maybe they have a question on one of the items that we marked yes for. And then also they take your Social Security number because it's what we call an MIB report. It's almost like having car wrecks, on a car if you're looking to see if a car has been damaged or whatnot, and it's all listed on there. Well, believe it or not, the MIB works the same way. So they will run an MIB, and they'll also run a prescription panel. And that basically says they're on certain medications. And once they do that research through that MIB and their prescriptions, then that kind of tells them whether or not they're going to accept you. But I don't want to sound like it's impossible, because I would venture to say the majority of people out there can move. Well, matter of fact, let me put it this way. Usually, I can guarantee you we can find something out there for you. In a Medicare supplement. If it isn't a different company, there is one company out there that doesn't even ask any health questions. Obviously, their premium's a little higher, but if you're on that company and you had a Plan F and you're paying astronomical for your Medicare supplement Plan F, it a lot of times is cheaper if you go to that one company that doesn't even ask health questions. So there's a lot of options out there, and I did go through a little bit about the Medicare supplements, but I want you to really think about something. What is Medicare? Well, it's nothing more than an insurance policy that the federal government gives you. It's broken down into Part A is your hospital coverage through your Medicare. Your Part B is anything to do with your doctor, your medical portion of it. Now, usually on your Part A, anybody that's worked over 30 quarters, or say you were married and your spouse had worked over 30 quarters and you hadn't even worked at all, well, you're still covered under your spouse. Now, the Part B, there is a premium to it. And the premium is a monthly premium. You can choose to have it taken. If you're not drawing Social Security, you can choose how to pay it. You can either have it taken out of your checking account, savings account, or you can go onto mymedicare.gov and pay your premium that way. If you are drawing Social Security, guess what? You don't have a choice. It's automatically deducted from your Social Security check. That's the way they operate. Now, again, if you're not drawing Social Security, they will even bill you on a quarterly basis. Now, there's a couple other little items that I want to bring up too. Is keep in mind that Medicare Part B is means tested. Well, what do I mean by that? Well, means tested, they have like 5 different levels. On the highest level can be over $500 a month. But here's the deal. Remember, they always do a 2-year look back. And so I've had this happen with clients that came in, and maybe the husband and wife both had sizable incomes, and their premium would have been over $500, but they were both retiring now. And so their income is much lower after their retirement because they're no longer working and they're relying strictly on their investments. So what I tell people that do that, remember, there is a form that you can fill out, and it's a change of life form. Change of life would be you are no longer working and you went into retirement. Maybe your husband passed away or your wife passed away, and that's a change of life incident for you. And so there are things out there that we will monitor and help you to make sure that you're not paying one nickel more than what you should. Now, again, with Julianne, Eric, and myself, and we mentioned this at our workshops too, that in Medicare world, all the prices are set by Medicare. I'll give you an example. If the Medicare supplement has a price that they set for their Plan G or Plan N, it is the same price whether you enroll on a paper app from something you receive in the mail, whether you call an 800 number with that company and decide that you're going to enroll on an 800 number, or if you do your research and decide that you want to go online and spend all the time comparing, getting that sheet from the insurance company and scrubbing through it, and you're reading that Welcome to Medicare booklet that you got in the mail when you turned 65 and enrolled into Medicare. Do all of that research for yourself. Or, for the very same price, you can have Julianne, Eric, and myself personally hand carry you through that process. And I can tell you personally, I'm walking in your shoes. I am on Medicare, have been for a few years. And so I know all the ins and outs. Why would you ever try to do that enrollment into Medicare on your own? Or why would you ask your neighbor what he chose because his situation may be totally different than yours? Why not talk to a broker that carries all of the companies in this area? We have no allegiance to the insurance company itself. Our allegiance are to our clients. And it's not only when you first enroll into Medicare for your first time, you turn 65 or you're 90 years old and you just went off of your group coverage, makes no difference. We will hand carry you through the process. There are questions that we ask because we want to get to know you. We want to know who you are. We want to know what your likes and dislikes are. We want to know what your travel habits are. Are you going south in the winter because Florida's much nicer in January and February than it is here in Elgin, and you have a condo or something in Florida? Well, we want to know that because it's very important with the Medicare supplement. It is good nationwide. It doesn't matter where you live or where you go. It travels with you. And again, anything that you would receive here on that Medicare supplement, you could also receive it. It doesn't matter what hospital or what doctor you choose, you do have coverage. And also, the coverage that you get in the Medicare supplement, you don't have to call the doctor and say, do you take whatever company that you're enrolled into? All you need to do is call the doctor and say, do you take Medicare? And if they say, yes, we do take Medicare, well, then they automatically take that supplement that you're on. Because remember, that Medicare supplement is tied together with your Medicare plan itself. So the Medicare supplement is tied together with your Medicare supplement, your red, white, and blue. So it doesn't matter what doctor you go to so long as you just ask, do you take Medicare? Now, keep in mind, all hospitals that are enrolled into or have something to do with the government has to take Medicare. So pretty much every hospital does. And so it's really important that you understand how Medicare works, what your different options are, and how the different premiums can change. Because I have had clients to come into my office and I have saved them, say, a couple that's on the wrong supplement that they've been on for a number of years. it's nothing for me to save them $100 a month or $1,200 a year. Let's say they're on the wrong prescription drug plan. Again, there's another savings there. So I think we're going to take a short break, and then we'll be back. And I have a couple more things I want to cover in the supplement world.
9:39, this is Medicare made ABCDeasy, and we'll be right back.
Nothing is overcomplicated. Mockingbird Bar and Garden promises to give your palate something delicious and new and aspires to be a hive of buzz and activity. Start your weekend with an espresso or complement dinner with wine, specialty cocktails, or craft beer. Visit mockingbirdbarandgarden.com today.
This is McGruff the Crime Dog, and I need you to help me take a bite out of crime. Counterfeit products are popping up everywhere. Fake sneakers, fake cosmetics, and even fake pills. Crooks are selling counterfeit versions of just about everything. Last year, billions of dollars worth of counterfeit products were sold in the U.S. Sure, it may seem like saving a few bucks on the things you want isn't a big deal, but counterfeits are usually made in unsafe conditions, potentially using hazardous and even lethal ingredients that could harm you and others. And the money you've paid, it goes right into the hands of criminals and may support child labor, drugs, and even gangs. Smells like big crime to me. So if you still think buying fake products is harmless, think again. And remember, if you don't know where the products came from, how could you know where the money goes? You're smart, buy smart. Go for real. Learn more at mcgruffpsa.org. This message is brought to you by the United States Patent and Trademark Office and the National Crime Prevention Council.
Is it noon already? Take your lunch hour up a notch with Out to Lunch from 12 to 2 p.m. right here on WRMN 1410 a.m. Unwind with the perfect blend of soothing sounds and lighthearted conversations that'll make every bite taste better. Whether you're in office or out on the town, let us serve up the best in radio company. Stream on the go with our app on Google and Apple. Because lunchtime is your time. Out to Lunch every day from 12 to 2 on WRMN 1410 a.m., the talk of the town.
From morning coffee to your evening commute, WRMN 1410 AM is here for you. The faithful friend that brings you local news, timely topics, and the friendliest voices in the Valley. Stay informed, entertained, and engaged with our full lineup of shows, streaming all day, every day at WRMN1410.com or on the WRMN app. Wherever you are, we're right there with you. So why switch stations? Stick with the one that has it all. WRMN 1410 AM, your daily companion, your constant conversation.
Over the years, you've brought them into your home. You were prescribed opioids after the C-section, when Dad injured his back, when your basketball star tore his ACL. Opioids helped with the pain, and you held on to them just in case. But did you know holding on to unused opioids puts your family at risk? Opioids are powerful pain-reducing prescription medicines, but most people who are prescribed opioids don't finish their prescriptions. So millions of unused opioids are sitting in homes across the country. And tragically, more than 100 Americans die every day from overdoses involving opioids. What can you do to protect your family? Remove the risk of unused opioids from your home. Pills, patches, or syrups in drawers, purses, and cabinets, anywhere they might be hiding. To find out how to dispose of them properly, visit www.fda.gov/drug disposal.
Medicare made ABCD Easy continues here on this Tuesday morning as we welcome Danny back to the program. Hey, Danny, welcome back.
Yeah, good. I just want to let you know our call-in line here at the station is 847 931-1410. And if by chance you want to ask a question, or maybe you have a product and you're not sure about, and you want to leave your name and phone number on our call-in, it's 630-320-6906, where you actually would leave a message. We will get right back to you. We also, our website is D as in dog, D as in dog, G as in George, insurance.com. So we kind of made a change in our website. We also have a app that we can use. Now, also, I'm going to go over some of all of the workshops as it's going to be available this month. We have 4 of them. The first one is Glendale Heights, and that's on April the 3rd. It's in the public library at 25 East Fullerton Avenue in Glendale Heights. April the 4th, Schaumburg Community Recreation Center at 505 North Springsgrove Road. That's there in Schaumburg, April the 4th. All of our seminars do start workshops at 6:30. April the 8th, we're at Glen Ellen at the Glen Ellen Public Library at 400 Duane Street in the beautiful city of Glen Ellen. April the 10th, we're actually here in Elgin at the Elgin Center, and we have one of the conference rooms there at 100 Sympathy Way. Again, that's a 6:30 start time. All of our workshops that we do in the evening are at 6:30, and we try to make them really interesting and stay within an hour. We don't like to have more than an hour, so 45 minutes is usually what we do, between 45 minutes and an hour, and we'll get you in and out. And what we cover in those workshops, we actually kind of dissect the Medicare supplement plan and how it works and what's the charges, and as far as Medicare Part A, Part B. We also go through the Advantage plan, kind of how do they work, and how do you enroll into an Advantage plan, or how do you make that decision between the two. So I think that on the workshops, that's the most important thing to get out of that workshop, because there's so many options out there. I know if you watch the TV or even listen to some of the radio, all they're pushing is the Advantage plans. So don't make a mistake and choose the wrong plan. So we will go through and explain exactly the differences between that Medicare supplement and between that Advantage plan. Usually once you go to that workshop and then you want to come into our office, because obviously you want us to hand carry you through the process, especially since it doesn't cost you anything extra, and we don't charge for our services. And I know what you're thinking. Well, how do we get paid, right? Well, believe it or not, the insurance companies pay us to assist you. So it is actually a no-brainer that if you are in Medicare now and you want to make a change, or if you're turning on 65 or you're retiring from your current employer, then you want to make that decision. And when you make that decision, if you are with a company that does offer a retiree plan, which they're getting fewer and far in between. Most companies say, once you leave, you go onto your Medicare, they don't offer anything. But if, let's say they do, then we do a side-by-side comparison. What their retirement plan is, what the charges are, what all they cover, and then we show you what's available on the open market through Medicare supplement or an Advantage plan. Now, let's say you're working, and people are working longer. They're not retiring at 65. Matter of fact, a lot of people cannot get full retirement until after they're 66 in a few months, at least at the people that are looking at retirement now. So when you come to the age of 65, you can go on Medicare, or you can stay on your group coverage, okay? It's your decision, okay? Here's how you make that decision. We will sit down with you and do a side-by-side comparison. We'll ask you, bring in your evidence of coverage from your group, and because sometimes they have, if you're on Medicare, the coverage is a little bit different, the premium is lower. So we ask you to bring that evidence of coverage in. And then we do a side-by-side comparison. What the cost would be with kind of the similar coverage that you have with your group and what it would be on the open market. And then we show you that, and in black and white, you kind of make the decision. Or if we ask you really important questions to kind of help you decide. One of the important questions that I ask my clients, okay, when it comes time that you have a major issue, say you have to have any surgeries done, maybe a knee replacement or a hip replacement, maybe they're looking at an angioplasty or some major things in your life. Who do you want to have to do that service for you? In the supplement world, you can go to any doctor in the United States that takes Medicare. So that's huge. Okay, if you are in an Advantage plan, or if you're in your group plan that you have now, usually you're locked into either an HMO or a PPO. And on the HMOs, you got to go to your PCP doctor, and then he will refer you to the specialists in his group area. In a PPO, you can go to any doctor associated with that PPO, and the cost share is cheaper. If you go outside of that network because that doctor that you wanted to do that procedure isn't in that network, well, then a lot of those co-pays that you normally would have to pay, a lot of them are doubled. So it's really, really important that you understand how Medicare works. What is your best option? And what's your desires? You know, we give you, our goal is just to educate you. We want you to make the final decision, but we want you to make an educated decision. A decision that you're happy with, and a decision that going forward you're going to be happy with if something comes up and now you have a major issue. That's what I always tell my clients. Don't be concerned about that little bit copay that you would have to pay to go to your PCP doctor. In most cases on the Advantage side, they're free. Let's not look at that. Let's look at the major issues in life. The ones that can cost you, like cancer, where you're doing the radiation and the chemotherapy and all of that. Those can start adding up. So that's why we really go through and break down each and every one of those programs so that you understand how they work and you're educated when you make that decision. Do I want an Advantage plan or do I want a supplement? Then we go through and we say, okay, if you want that Advantage plan, now we need a list of your doctors. We need a list of all your medications that you're on, because we want to match the Advantage plan to what you have now. We don't want to see you have to change all your doctors. So we will look there. And in a lot of cases, we can get you the same Advantage plan with the doctors that you're seeing now. On the supplement, it's relatively easy. Any doctor, any hospital in the United States, you just have to call them up and say, do you take Medicare? So it's a little bit simpler. And that's the reason why it is so important that when you sit down with us, we get to know you. And I cannot, for the life of me, figure out how these people make recommendations on an 800 number. All they do is ask you your zip code, and then they tell you what plans are out there, and how they can make a good recommendation, or how you as the client feel that you have made the right decision, when basically you didn't do the research, or that person that you talked to on that 800 number doesn't know you, and they didn't do the research that needs to be done. Because keep in mind, in Medicare world, once you make a decision, and especially if you end up having some health issues, you may be on that Medicare supplement or Advantage plan for a number of years. So you want to make sure that you're very, very comfortable with that decision that you make. But also, keep in mind that you have teamed up with Julianne, Eric, and myself, where we have almost 40 years of combined experience in the Medicare world. And like I tell my clients, hey, I'm walking in your shoes. I'm on Medicare. I know, we know, between Julianne, Eric, and myself, we know more about Medicare than if you go to the Social Security office and ask the question. Because a lot of times they're just reading something, they type in your question, and then the answer pops up. They're not in the field. They're not dealing with clients all the time and answering questions. I tell my clients, I said, get your cell phone out. I want you to put my cell phone number in your cell phone. If you have a question, please call me. Don't call 1-800-MEDICARE, get put on hold, and then sit there for 20 or 30 minutes, and then you lose communications and you have to do it all over again. Or don't call the insurance company, and the person that answered it probably isn't even in the United States. And I don't know about you, but when I'm on the phone and they have really broken English, it's hard for me to understand. And so you want somebody that is local. And we have a lot of different options for you. You can communicate with us on telephone. We have a Zoom capability that we can zoom in on a meeting with you over the phone. We have a location right here in Elgin, right on Davis Road. We also have a location in Oak Brook, right across from the Oak Brook Shopping Center. And believe it or not, we still make house calls. If it is not good for you, you're not good with a computer, and you really want somebody to sit down with you and personally hand carry you through your process, we will make a home visit with you. So there isn't any reason why that if you have questions or you're on different programs out there and you want to see if there's something better out there for you, or something that is less expensive for you, there's no reason that you don't. If you give us a call, it's 630-320-6906. Leave your name, your phone number, and kind of a little bit of information of the reason for your call. We will call you back, and then obviously we can set an appointment with you in one of our offices in Elgin, Oak Brook, or we will actually come to your home and we will go through, or meet you at McDonald's if nothing else. So the options are all there for you. We also have, I'm going to just go through these real quick. April the 3rd, we're at the Glendale Heights in the Public Library. April 3rd. April 4th is Schaumburg Community Center, a recreational center in Schaumburg. April the 8th, we're in Glen Ellen at the Glen Ellen Public Library, and I want you to circle the calendar. April the 10th, we're right here in Elgin at the Elgin Center of Elgin in the conference room at 100 Symphony Way. Circle that, 6:30. You can call and make a reservation at 630-320-6906. So with all of that, I think that we're almost up in time.
Yep.
So I'm going to let you go. We will see you a month from now on the first Tuesday of May.
Sounds good, Danny. Thanks for the great information. That wraps up the show here today. And coming up next hour, we will have the Brian Kilmeade Show. I'll be back with Out to Lunch. And that'll be from noon until 2 with myself and Sonar. And then we'll have the Radio Shopping Show at 3. Don't forget about the Redemption Center opening up today at noon. Noon to 3, you can order from the Shop Show at 847-741-7700. That's 847-741-7700 between noon and 3. Check out our website at WRMN1410.com. Coming up next, Brian Kilmeade right here on WRMN.
Your hometown radio station since 1949. We are WRMN AM 1410, Elgin time, 10 o'clock.
With your AM 1410 WRMN Newsflash, I'm Sean Kernan. Brought to you by Sky Rizzy. Explore proven results with Sky Rizzy. In Elgin, the community is encouraged to contribute to the neighborhood forests and